We're live. Mike Goscinski, welcome to the future of fitness.
Hey, thanks for having me.
Yeah, my pleasure, man. I have enjoyed our conversations over the past month or two. Somewhat fresh off the Health and Fitness Association conference about a month ago. Of course, formerly URSA, which you're going to explain a lot about here in a minute. But it's going to be great to get some insights on what you guys are up to now, what the vision is, what advocacy means for the industry. I think there's so much that people just don't understand about your association that is really important because the work that you guys are doing on the Hill affects everyone in our industry, and that's not just from a business perspective, but from our clients and consumers and members and families, really. So it's important. That's what I'm trying to say. So, Mike, let's start with this as usual. If you don't mind, just give us a little of your background, set the table, and we'll take it from there.
Yeah, absolutely, Eric, and thanks for having me on today. I really appreciate the opportunity. So my name is Mike Goscinski. I'm the Vice President of Government Affairs for the Health and Fitness Association, the newly branded Health and Fitness Association. And I come to the health and fitness industry previously serving in a similar role, but always for food and beverage and retail industries prior to this. I grew up, born and raised in New Jersey, moved down to Washington, D.C., in the heart of the economic crisis and worked for a member of Congress from New Jersey, and then took my career off the Hill to work for 501c6 trade associations, representing industries and being able to share their voice with elected officials, policymakers, and influencers in Washington, D.C. to try and connect the dots between how policy and the work that is happening here and in state capitals across the country actually impacts those businesses trying to operate on the ground across the country. So I've been doing this in DC now for about 15 years. It's an exciting time. The energy has, I imagine, always been this exciting, but it just feels new to me, exciting to me. And having the excitement be focused on advocacy, public policy, and really helping move the needle has been so incredible since I've joined formerly URSA back in December of 23. So I came in right after the pandemic, and I'm just excited that that is behind us. The future is in front of us, and it's exciting, new, and we can really help chart a new path.
Right on, right on. And one of the things we will cover too, but just to mention it here in the forefront, is the fly-in event. When is that again, Mike?
Yes, we have our what I'm dubbing our inaugural Health and Fitness Association Fly-In and Advocacy Summit in Washington, D.C., May 7th and 8th. Yeah, excited to share more on that. But we have done two previously since I've come on board under with URSA, and then in partnership with Al Nashavani in the Fit Tech Summit this past October. So it's been exciting. We've been helping to make our voices heard in the nation's capital, and people are starting to listen.
Yeah, right on. Great. Well, we'll get into that a little bit more and all the details about it. But yeah, I guess the first question I had is when Liz, you've known Liz for a while, is that right? You've worked with her for a little bit.
Yeah, actually, I've known Liz about 15 years, shockingly at this point. But we both formerly came from the food world. She was with candy, I was with bread. It was a match made in heaven. But we talked about a lot of issues on the Hill together. I like to joke that we both came from calories in and went to calories out, but that's just me. But it works on the Hill. It works with legislators.
Yeah, that's funny. Very memorable. The when you guys first came to this industry, was there anything that you thought like immediately you're like, whoa, okay, there's some major issues here, like or things you're like, wow, they're actually doing some things right. Like, what was your first impression?
The industry does so much right? The industry itself is built upon doing what is right. It's helping people have access to physical activity, having access to staying fit, staying healthy, taking care of their mental and physical health. The entire industry itself revolves around doing and being what is right. Where we saw that, where I know Liz saw the gaps when she came on board and hiring me, where we saw the gaps in building a strong advocacy program, is really the recognition and the reputation with lawmakers. Liz likes to say, if you don't have a seat at the table, you're on the menu. And that is true. And the industry saw it during the pandemic when in Washington, D.C., industry after industry was clamoring, talking with policymakers about having the industry deemed essential. And we know this industry is extremely essential. Americans know this industry is extremely essential. Everyone around the world knows that the industry is extremely essential to the mental and physical health and well-being. But making that case to policymakers required having someone here to share that voice. And that was where the gap was. And that's what we're trying to fix. And doing a good job of it, if I can say so myself, since we've been here, right? We're building the relationships, we're having the conversations, we're connecting elected officials directly with the businesses within their districts and the communities that they serve, and the constituents that utilize all of the businesses that this industry is comprised of to take care of their health. And so that's the immediate gap that we've been working to fix. And it's all about that consistent drumbeat of having conversations, building relationships, talking through some of the hard conversations, right? Everybody wants to bring up the bad attributes of an industry, right? Everybody brings up the one time they couldn't get out of a gym membership, or the horrible problems that they've experienced at one location, or the one spin instructor that they couldn't stand, right? You'll always hear that. But at the end of the day, we have a huge beneficial springboard in the conversation, because I'm no longer talking about donuts. I'm out there talking about people staying physically active and getting healthy, which is a huge bonus.
Yeah. And no knock to donuts.
No,
I
not
think they're
no knock to
fantastic.
donuts at
I think they're
all.
fantastic.
Listen, I love them, and it's why I work out as frequently as I do.
So I think I had Liz on about 2.5 years ago now, from when this will probably be published. So, back then we were just talking. She was talking about the rebrand was coming. Advocacy was definitely the primary focus. So that was the two things: rebrand and advocacy, right?
Yep.
Over the last 2 years specifically, like, give us some ideas. Like, what have been some of the bigger wins that you guys have gotten since that time?
Well, first and foremost, I'm here talking to you today as an employee of the Health and Fitness Association, which I think is an evolution that has been a long time in the making. Being, particularly from the advocacy side, being able to talk to a lawmaker and say, "Hi, I'm Mike Goscinski with Health and Fitness," as opposed to, "Hi, I'm Mike Goscinski with IRSA," and then having them come back and say, "Okay, well, what does IRSA stand for?" And then having that discussion, it's a huge win. And Liz, with the empowerment of our board of directors, really pushed for that. It's a long time coming and a very exciting new future. So that's first and foremost number one. We've also been able to, really start to hone our focus. The association today is really focusing on three main pillars of what and how we're going to service the health and fitness industry. And that is through advocacy on a global scale, right? Making sure that we are on the ground here in Washington, D.C., throughout state capitals, being that direct lobbying voice, talking directly to lawmakers, but on the global scale, making sure that we're working with our federation partners, working with organizations and others throughout the global scheme to make sure that the industry is all speaking from the same song sheet, talking about the same items, and making sure that everybody is hearing the same message, that physical activity is not just a hobby, but preventive health, and learning and understanding why at all policy turns, we should be considered as such. And then the second pillar that we're focusing on is our education. That is where the trade show comes in, making sure that everybody is understanding what is going on in the industry, being on the forefront and making sure that we're delivering the tools and resources that fitness facilities need around the globe in order so that businesses to be successful, but also making sure that they understand the complexities of the world that they're living in and making sure that they're prepared for any changes that may be coming down the pipe. The last of those three pillars is our research arm. And that's something that the industry and the association has always been proud of. We continue to strive to meet that and bring out some new products that the industry can rely on, but also think about looking at different avenues, such as other communities that may not be thinking about the industry and utilization of the industry in a way that it can be utilized. So looking at the investment communities and others to make sure that we really we're putting together, but B is driving all of the ways that we're working on behalf of the industry and the policy realm.
Yeah, interesting. And I want to definitely get a little bit more into the research. I think that's something a lot of people don't know about. Mike, when you give us some insights into, because I don't really know, so I'm guessing most people listening don't really know, but the organization itself, right? It's nonprofit, right? Like, how do you guys get your money? How do you get your funding? Like, where do you make money? Where do people, provide, funding for you? Where does all that come from?
Right. Yeah, we are to take the wonk out of it, simplest terms, we are a non-for-profit trade association. We are set up with in a way that we are a membership dues-based organization. So all of the work that we do and the product that we produce is done by the generous membership of members in the industry and the generous contributions of the industry through sponsorship, purchasing of products, etc. Again, we are a not-for-profit organization. So everything that we do on behalf of the industry is made possible by the commitment of the industry being members of our organization and taking advantage of the resources that we have available to them.
Awesome. And if someone becomes a member of the Health and Fitness Association, what does that look like? As far as I'm sure there's various investment levels, but what do they get in return for being part of the team?
Yeah, no, absolutely. You get access. So we do have uh, different options of membership, but first and foremost, our main membership program provides you with the education, that research, and those advocacy tools. And of course, if you're a United States-based member, that direct advocacy and sharing your voice. It also gives you the opportunity to engage across all three of those opportunities, right? So from the advocacy perspective, which I'm the most equipped to speak about, is you can engage with us in terms of being a member of those who help shape our advocacy voice. We have produced policy positions that guide our principles over the year. But also we have the opportunity to have a grassroots advocacy network that helps us communicate with members of Congress and staff. We're able to help you with that. But there's also resources that are delivered from the advocacy program that help you run your business, right? So take, for instance, as an example, if you live in the state of Maryland, where we just had a really successful policy win, the state of Maryland, their state legislature was looking to eliminate the usage of liability waivers by fitness clubs and fitness facilities in their business, which, as we know, are pivotal to have in place in order to get affordable liability insurance and to be able to make sure that you're operating safely and not at risk of undue litigation. We've been fighting this bill for 2 years, and the trial lawyer community and those who are advocating on behalf of removing liability waivers has been in our face, pushing back, and in legislators' face, pushing back, saying that they should not be exempt from this. Thankfully, as of yesterday, there's a bill on that's heading to the Governor Moore's desk in Maryland that incorporated an amendment that we were working with to fully exempt the health and fitness industry. We are the only industry fully exempt, thanks to our engagement, other than the hotel industry, which utilized our messaging of saying we need to be exempt because we had fitness centers, and they piggybacked off, and we're the only two exempt industries in the entire state that's now allowed to continue utilization of liability waivers for adults' usage of clubs and facilities. So I use that as an example to say, in our minds, and some of the stuff that we were preparing, is we're fighting like hell to make sure that the industry is protected first and foremost, gaining those amendments, stopping the legislation. But at the same time, working to make sure that the education and tools are there for our members to understand what happens if it happens, if it's happening, when it happens, and what they need to do within their business to make sure that they're not only in compliance, but protecting themselves now that new laws are going into place. So that's a little bit of some of the resources that we provide. Also, you have access to the research, as I mentioned earlier. Our premium members all receive that free of charge. It's access to all of our issue products and anything that can help not only drive your business to be successful, but help protect it in the long run as you're looking to navigate the world of your own businesses.
Yeah. Why would I guess I kind of get it, but in that Maryland case, why would they want to get rid of waivers? Is it just so that the businesses are more liable for injury? Is that really
I mean,
kind of the
yeah,
fundamental piece of it?
I can give you my cynical answer, but
Okay.
I won't, because you never want to guess someone's ulterior motives. The
Sure.
rationale that they were utilizing is they were utilizing the child's case, or the case of children, where a parent goes to a trampoline park or an
Mm,
amusement park, and they sign a waiver to sign the life away of their child. And look, we have no skin in that game. We have no objections to why and the motives of doing that. And we frankly said, and that's why we crafted the amendment language that we were working with. We understand why Marylanders and the Maryland legislature wants to protect children. Nobody disagrees with that. But by doing a broad sweeping bill that encompasses the industry, which comes with the assumed risk that everybody knows when if you walk into a regular gym, you understand the assumed risk of picking up iron and putting it back down. People understand the assumed risk of, cardiovascular exercise, et cetera, et cetera, et cetera. So conflating a piece of legislation aimed at protecting children to something that then exposes so many in the business community to sue and settle litigation or undue litigation threat is where my cynical view comes in, and I'll leave it at that. But thankfully, we were able to make that case. We were able to talk to the lawmakers and say nobody is standing in the way of you protecting children. What we're doing is protecting our industry and trying to protect the ability for our industry to be able to continue offering affordable access to men, women, and everybody in the state to have access to physical activity.
awesome. Yeah, this reminds me of a example I had in my gym operator time where advocacy or collectively getting together as an organization was super valuable. So CrossFit RG, I don't know if they're still around, if you're familiar with them, but as a CrossFit gym owner, there's a lot of media started surround right around 2010 of rhabdomyolysis being a case for
Mm-hmm.
people doing CrossFit, right? So what happens is you start to get these copycat cases of people going to CrossFit gyms, working out exceptionally hard, dropping in, right? Intentionally getting some level of rhabdomyolysis and suing the crap out of these little gyms. And that's how the organization started. It was very predatory,
Right.
and it was pretty nasty. But I'm glad they came and kind of pulled everything together. So hopefully they're still around, or I'm sure they are in some way. But that was a direct benefit to me as a gym owner. I think this is the kind of stuff that people need to start paying attention, because it's hard. Like, as a gym owner or operator, there's a million things you have to worry about. Like, the last thing you want to think about is what's going on, around you legally, or what's going on
Right.
the hill, right?
Well, and that's exactly it. That's exactly why we're here, right? I take pleasure in reading legislation, going line by line, the wonk of it all, right? But fitness facility operators and owners don't have the time to do that and run a business as well. So what I like to do is talk about advocacy from the insurance policy perspective, right? You wouldn't open your business doors if you didn't have strong insurance to protect your business, protect your employees, and protect your livelihood. Why wouldn't you consider advocacy on behalf of the industry a part of that policy? And when I say that, I say in terms of membership with an organization like the Health and Fitness Association, where my sole responsibility is to pay attention to all of the threats that are coming at the federal, state, and local level, and make sure that somebody is talking about that with those lawmakers. That is an insurance policy that the industry itself doesn't need to worry about, but can engage in, learn about, and understand more about the work that we're doing and how it's helping their business.
Mike, if you look at like the next year or two, I don't know how far your horizon goes here, or how long these things take. But what do you think are some of the most significant challenges and opportunities that we're looking at as an industry right now? Like, what are you guys really focused on?
Yeah, I don't see any of them particularly as a challenge. I see them as an opportunity. And
Cool.
what I mean by that is if you asked us, at a convention trade show, Liz did an on stage interview with Mark Mistroff, and everybody an icon in the industry. Uh, and he talked about his big, hairy, audacious goal. And I just had an article in our most recent edition of Club Business International, which is the publication that also, as a member, you receive if you're with us. But it just talks about all of the things that we're focused on. And I have an article in this month's edition that talks about, what is my BHAG, which is my big, hairy, audacious goal. And that is, a a revolution of the healthcare industry that physical activity is seen as a preventive health measure across all aspects of chronic disease and non-communicable diseases. And what that means is the industry itself is seen as a valuable resource to public health, as opposed to just a hobby or something about for individuals to get bigger or get smaller depending on what their goal is. But so when you look at the public policy landscape and everything that comes with it, there's opportunities for us across the board to continue to build around that goal and continue to show value, right? We have a huge weighing mental health crisis in the United States. And we all know that physical activity in the simplest of going out and having a spirited walk for 10 minutes can help lower your blood pressure, help calm you down, and help a lot with mental well-being. We need to be a part of those discussions. And so there's a lot of policy threats out there, but being a part of the discussion and making sure that they understand that the industry, again, is not just a single location on Main Street that someone goes to work out, but is a part of the overall healthcare continuum and a part of making sure that Americans stay and get physically healthy and mentally healthy is I think, again, there's an opportunity in every single piece of legislation that's introduced and every regulation that they try and push out.
That actually segues nice into something that I wanted to ask you about, because it's come up on this podcast numerous times. I don't know how many times, just in conversation with people in the industry, but the FIT Act. What is going on with that thing? What's the update?
Well, it's still here. And I say that jokingly because every time we talk about it within the industry, why are we still talking about it? Why we're still talking about it is because if you look at what I just mentioned, getting to a place where physical activity in the health and fitness industry can be assessed, prescribed, and then referred to locations where then somebody can come after a doctor says you need to have a physical activity routine, and I can go to a yoga studio, a spin studio, or wherever I do of my choosing where I feel comfortable to get that physical activity, then there's a longer road to get there in a right way, starting with the FIT Act. What the FIT Act does in the simplest of terms is it changes the treatment of physical activity. The term physical activity changes its treatment in the IRS code to make it considered preventive health. And if physical activity by the IRS is changed to mean preventive health, the dominoes start to fall in place for assessment, referral, and utilization as a preventive health measure. And so, yes, the FIT Act is great. We reintroduced it back in 2023 with more support than ever before. It's currently sitting with 70 bipartisan co-sponsors in the House, 20 bipartisan co-sponsors in the Senate. Everyone loves it. Every time I have a conversation, members of Congress jump on board. I was with the sponsor of the bill yesterday, a member of Congress named Mike Kelly from Pennsylvania, and I was talking to him. He's a great champion of ours, great champion of the bill. But I was talking to him about it, and I as an advocate pushing for the bill, I said, every time I have this conversation, whether or not it's in a room with other lobbyists and a lawmaker, or just an office, a room full of people talking about what I'm working on, I gain so much support from within the room because I say, we're working on a bill that makes it eligible to use your HSA and FSA spending, physical activity expenses, and youth sports. And there's always the one person that says, I would love to be able to pay for my gym membership with my FSA funds. And there's always the person in the room that says, wait, you mean to tell me that it's possible that I may one day be able to pay for my son's soccer with my HSA or FSA? And once they hear that, it creates the excitement in a bill that has been around for a long time because people see it as a gateway forward. Looking back at the pandemic, which I'm getting to the point where I'm really trying not to do anymore, so I apologize for bringing it up, but kids were secluded. They were out of school. They weren't playing sports. They weren't playing with their friends. They were told to stay in the house. We all know what happened, but coming out of that, how many of those kids are out playing sports now? Or are they still on the computer? Are they still on the iPad? Are they still playing video games? How many of them are out learning what many of us learn from organized sports? The team building, the bonding, and just the general, developmental training that came along with all of that. And so there's a lot of opportunity for us still. And it's just about telling the story the right way, talking to people the right way, and, for lack of better terminology, playing the game appropriately. Liz and I, collectively with Jeff Soulsby, who's our Senior Vice President of Communications, we bring nearly 55, 60 years of Washington, D.C. experience, which allows us to understand who the power players are, how a bill like this actually moves, and who we need to target in order to make sure that when the time comes, there's a vehicle for this to ride on, or it gets passed out of committee, and the appropriate people are making the moves on the Capitol Hill to get it done.
Awesome. One of the things that just popped in my head is, who drove this? Like, obviously, Liz got hired as CEO. That brought in a strong advocacy angle. But who was responsible for that? Like, who's the one within URSA and was like, hey, we need to make a significant change of direction?
Not the one, it's the industry itself, right? If you look back, as I mentioned, when you ask, what is Health and Fitness Association? What is an association? We are here to serve the membership base. And so when, coming out of 2020, realizing that there was quietness in the voice in Washington, D.C., right? The appropriate voice wasn't there to really get things done, make the changes, make sure that the industry's voice was heard. That's what led to it. And again, the board of directors, some who were serving them and then those who continue to be here now, they really drove the change that they understood the membership wanted and needed. And the industry as a whole needed, right? It's not just about servicing the members. At the end of the day, everything we're doing benefits the industry as a whole. We're working to benefit the industry as a whole. And the board saw where the gaps were, the membership saw where the gaps were, and they sent a clear message that this is where they wanted the industry to focus. So that's when, Liz came on board, and she's been continuing to reshape the way that we operate and what we're focused on, and all the better.
Yeah. We have an election year. We're in an election year, right? What?
Yes.
I'm not going to ask you who you're going to vote for. Don't worry. But
it doesn't matter to me. Whoever's here, I have to talk to, and we'll talk to. That's the point, right? At the end of the day, it never makes a difference.
What consequences, or is there consequences for this year's election on our industry? Like, is there anything that people should be aware of when they're when they're dropping their ballot?
I think at the end of the day, it's more so not about who you work for or who you vote for, excuse me. It's how you engage with them. And so I think even as we're looking to the polls, think about, the old saying, all politics is local, right? As you're looking at your representative, think about who's going to represent your interests in the best way. Think about who you might be able to have a conversation with and express your interests to, who's willing to talk to the industry. We have a lot of great information available to our members in the United States to learn about the candidates, but also at the end of the day, we talk to a lot of them. So ask if you're, if the person who represents your district is a champion of our industry. I'll happily have those conversations. The one thing I will say about the election itself, not just the presidential, but the House and the Senate, is regardless of what happens, we live in Washington, D.C. on a 2-year to 4-year cycle, depending, right? The House changes hands every 2 years, whether they change party hands but regardless, half of the people there, the faces change, the staffs change. Everything tends to be very cyclical here. And so regardless of how you look at who wins, know that we're here talking to them. And there's a re-education, re-engagement, and build off of a conversation that we are continuously having. And regardless of who wins, know that it does not matter. There's never a time that you, as in the industry, you as a leader, or us as the association, can ever be caught off guard again, could ever not be engaged. And we will be engaged at every level across the board to make sure that that doesn't happen or never happens.
Yeah, awesome. The fly-in, so May 7th, 8th, so pretty soon, as this will be published, very quickly in time for that. But yeah, tell me about that. What is it? What's going on there?
Yeah, it is. It's such an exciting event, and it's something different. You know, I do this job for a living, but I always enjoy when I see people come to town and experience it because the excitement's there, and everybody goes out of here fully energized and wants to be more and more engaged in the advocacy process. It's May 7th and 8th here in Washington D.C. It's a 2-day event. The first day, May 7th on Tuesday, is all about education. We bring in speakers to let you learn about the policies that we're working on and the background, right? So we're talking about the FIT Act up on Capitol Hill on Wednesday with members of Congress. On Tuesday, you'll hear from somebody who will focus on why physical inactivity is a detriment to the youth of our nation. Like, what does it cause in terms of chronic disease, diabetes risks, right? Mental health risks. And it's painted in a way that helps you understand and know that those talking points when you're up on the Hill talking to legislators. There's some networking and fun in between. On Tuesday night, we're going to head down to Nats Park for the Nationals to play the Orioles.
Nice.
Generously sponsored by ABC Fitness, our lead sponsor on the program. And we'll be able to have 75 minutes of private food and beverage happy hour and reception behind home plate. Going to be a lot of fun. All attendees get to come as part of the program. And then we all get box seating with food and beverage for the game. Just a way to relax, network, meet your colleagues, meet everybody else who's interested and focused and enjoys being engaged in advocacy. And then on Wednesday, we take to Capitol Hill and we organize into groups based off of where you're from in the country. And those groups go around regionally to members of Congress, meet directly with members of Congress and staff, are fully educated from us and on how the conversations, the talking points you need, et cetera. But they're really just relaxed ways for us to introduce business owners to the people who represent them and people that make policies that impact their business. And that's the name of the game, right? Is building that relationship, making those introductions, and then the follow-up of making sure that we continue those conversations. Because then when Congressman X is voting on a piece of legislation or writing a piece of legislation, he'll say, oh, I wonder what that will mean for the Health and Fitness Club, and wonder the impacts this will have on the health and fitness facility in my district, right? And that's the end goal. The end goal is to make sure that they're thinking about us before we're engaging with them. That way it makes my job easier. It makes your businesses a little bit more protected. And at the end of the day, makes, operating a little bit more tenable.
And
So
who?
again, 2-day event. I apologize. It starts Wednesday or Tuesday at noon in Washington,
Okay.
D.C. It goes until 5 p.m. on Wednesday. We do have a hotel room block. That is the one deadline that is actually coming up on April 15th. So we do have a reduced rate at 2 hotels in Washington, D.C. that are very convenient for all of our attendees. So if you're interested, please head to our website and check it out and look at the links. But I will say that deadline passing at April 15th does not preclude you from coming or engaging afterwards. If you're interested, or if you have, if you're a loyal member of a different chain and would like to stay at your own hotel, you can book and come to register and join us in Washington, D.C. anytime before the event between now and May 6th.
Awesome. Yeah, I mean, it's hopefully this gets out by then. As far as publishing, it's going to be cutting it close, but I think either way, people will get the point. Who generally shows up to these things? I mean, well, I guess how many times have you guys done these? How often do you plan on doing them in the future? And who have you had so far, and who would you like to see more of?
Yeah, so it's an annual event. We've done, since I've come on board, we've done 2 of them. So our first one was in May of last year. We like to do it in May because May is Physical Activity Month. The president signs a declaration. It's been historical. Governors, we're working right now with governors across the states to sign proclamations in each individual state so that everybody is collectively recognizing it as Physical Activity Month. But we've had so far 2 very successful ones. We've met with over 140 members of Congress and staff. We've brought roughly about 130 individuals to Washington, D.C. It tends to be folks who are at the executive level, council, marketing team, but it doesn't have to be. It could be anybody who is involved in your business that can tell your story. Because at the end of the day, that is the only reason why I love having folks come to town, because I can talk all day till I'm blue in the face, as I'm sure you and the listeners, I'm sure, will realize as well. about the policies, about everything, and about what we're working on. But the one thing I can't do is tell your story, tell why you're in this business, talk about your business, talk about the clients that you serve. I can allude to it. I can talk about the industry in very broad strokes, but everyone coming and actually weighing in with the lawmaker, that is a real tangible story that they can understand. It's a face that they can put with a name. It's Joe's rowing studio on 13th Street, and they now know who Joe is. So, why should you attend? It's simple, right? We educate lawmakers on the mental and physical health benefits of physical activity. We establish and strengthen those relationships with members of Congress, staff, and the businesses within their districts, the members that represent you, the staff that represent you. And at the end of the day, we're all here to advance the reputation of the health and fitness industry and make sure that we are considered whatever and wherever they're making policy that may impact us.
Awesome. I want to get your thoughts on this because I've talked about the pandemic ad nauseum on this podcast as well, but that combined with like the critical state of this country's health, right?
Yeah.
And all the projections for healthcare costs, like as dismal as that looks, that's got to put some wind in the sails for our industry, right? Like, especially like, here's the thing that people, are starting to realize too, is like, we have very few young people in this country that are eligible for the military due to their physical status, right? That's a big deal to Washington, D.C., right? That's a big deal to the people who run this place. So as these kind of like, fortunately, negative things are starting to come about and just become squarely in our face as problems and issues that need to be dealt with, is that putting a little bit of wind in sails as far as what we're trying to do as industry and what you guys are trying to do?
It is, and we're actually having that conversation. So you're right, 77% of the nation currently is of eligible people in the United States currently to serve. 11% of that is because they qualify as obese. Another 13% is because they have mental health issues that preclude them diagnosed. And so it's a real challenge. In the last 2 years, I believe, and I might be speaking out of turn here, but I believe all branches of the U.S. Armed Services failed to reach their recruitment goals. And so members of Congress are extremely focused on this right now, right? How do they focus on recruitment, readiness, and retention? Because at the same time, you can be an enlisted member of the armed services, but if you get injured, fitness standing, or you're not, right? If you look at the Guard or the Reserve, where you're not, many of them are not meeting the standards needed to pass the physical activity exams or stay healthy in between service. That's a real problem. So we're actually talking with Congress, and we're working with them on a pilot program, hopefully that will be included in this year's defense authorization budget. That would do just that, and it would utilize the industry to say, hey, look at reservists and guardsmen and women across the country. Why would you require them to, come on base to stay healthy rather than utilizing the industry within their own community and then coming to duty in the shape that you need them to be, right? So we've developed a pretty cool program, pilot program that we're trying to run through the budget process here in Washington, D.C. that we'll be talking about at the fly-in, just another item that we'll be sharing with members of Congress. But to your point, there's a lot of focus right now by members of Congress and particularly their staff about not only military retention and recruitment, but the entire health of our nation, the mental and physical health of our youth, our seniors, and all of the impacts that has on the astronomical healthcare spending that we are required that the American government is required to take on year after year. And so that's another way that we're looking to frame it and have the conversation is healthcare spending is astronomical. Why would we not shift focus to prevention and take away some of that cost on the back end?
Yeah. Well, there's one answer to that question. There's some people who make a boatload of money off of it. And that's, the cynical point of view on it, but it's just true, it really is. And the projections that we've had, I've talked to people on this podcast about what's going to happen to the cost of healthcare and what that's going to do to our country in the next 10 to 20 years is horrifying, dude. Horrifying.
Yeah.
And,
well, and
I feel like, go Go ahead.
I was going to say, and what we know from our data and our research is that for every $1 spent on preventative health through physical activity, it saves the healthcare system $3. For every $1 invested in preventive health, $3 is saved. It's a no-brainer, but again, to your point, it's about shifting the focus, the understanding, and the way that folks are working on it.
Yeah, cool. How are you guys getting all this information out there? I mean, there's a lot of stuff that you just said that people aren't quite aware of. Like I said, like understanding, clarity, transparency, full on like what the Health and Fitness Association is doing. Like, what are the plans to get more information out there to the people who need to hear it?
Yeah. So obviously, please, head over to the Health and Fitness Association website, subscribe to receive updates. I send out a monthly advocacy update that is everything in a nutshell of what we're working on, some high level, just to stay engaged in a very minimal way. You can engage with us on social media. I'm on LinkedIn. Our organization produces a lot of content on social media as well to keep everybody up to date. And then, of course, working with folks like you and making sure that we're sharing all of the work that we're doing is really helpful to reach a broader subset of the population in the industry. So we're really appreciative of that as well. But it's a continued evolution, and we're trying our best to continue to make sure that we're making the industry as informed as possible at all times. So bear with us, because we have a lot of stuff in the pipeline, and we're going to continue to make sure that voice, your voice, gets louder in Washington, D.C. and State's House and policymakers around the globe, but also that our voice gets louder so that you're hearing what we're doing.
Right on, man. I'm really bummed I'm not going to be able to make the flying event next month. I'll be, on my way back from Uzbekistan, which is a whole nother story for a whole nother podcast. But it sounds like a great event. I would love to, interact with people on the Hill. It just sounds like a really eye-opening experience and very valuable too. So yeah, I really urge people to check that out. And last question, Mike, is like kind of general, but you probably mentioned a bunch of this. Like, what's your biggest challenge right now? How, as an industry, can we help Mike? And then if people want to get in touch with you or learn more, where would you want them to go?
Yeah, my biggest challenge is what I'm here to do, and that is making sure that we're getting in front of as many people as possible, both with the policy side and then also with people within the industry. So when it comes to engaging with the Health and Fitness Association, please consider membership, consider engaging, consider joining us for the fly-in, or joining at least, the very least, our newsletters to see the work that we're doing and taking part in the work and the transformation that's happening. As I mentioned, folks lending their voice, even if it's through email. We have simple one-click campaigns on our website that you can weigh in with items like the bill that I talked about in Maryland. And with one click, you can send a letter to the governor saying that you're a business owner in the state and disagree with it. We make all of that easy for you. So please feel free to reach out to me and find out more about that as well, because grassroots advocacy is what's going to help us get this over the finish line. And also consider that, while I consider the industry my grassroots army, so many have consumer base that's an advocate as well. Just as like the story that I told about talking to people in a room and people being excited about the possibilities of the FIT Act, if your customers knew that the industry was working to get their HSA and FSA dollars eligible to pay for their membership or to pay for their classes, they would be just as excited. So sharing that and sharing the work that the industry is doing, sharing the research, sharing the points on social media, that helps us build that groundswell of support that lawmakers need. And then in terms of what else can do for help, just see me as a resource. If there's anybody that ever wants to connect and learn more about what we're doing or anything the Health and Fitness Association is doing, we're happy. We have a great team on board to help have that conversation, and we're here.
Cool. And how do people get a hold of you personally? Like LinkedIn, email? What do you want to do?
Yeah, I'm on LinkedIn. I don't know if there's show notes or something that we can put the links in, or
Yep.
healthandfitness.org is the website. Contact information is on there for me. My email is Goscinski@healthandfitness.org. So feel free to reach out to me, but LinkedIn's the best. It's where I'm most active. So if there's ever any questions, feel free to contact me there.
Yeah, right on. Well done, Mike. Obviously, you speak the language, man, that a lot of people in this industry don't.
It's a
So I'm
well
glad.
rehearsed script, Eric. I think,
Yeah,
at the end of the day, I talk about it a lot, so I appreciate it.
yeah. I was going to say it's all repetition, right? We'll really appreciate it, Mike, and good luck at the event. I'm sure you and I will be talking soon, but yeah, keep up the great work, ladies and gentlemen. Mike Kaczynski.
Thank you.